We're moving into some lower body work. We're going to begin by foam rolling our posturally tight hip flexors, starting on the concave side, spending a little more time. You'll be on your forearms. Don't collapse into those arms. Digging into the groin area, hip flexor area, which is located here. Dominant leg first, other legs out to the side. You can always pad the knee of the other leg if you're noticing when you put it in that butterfly position out to the side, it is getting hit in a spot that bothers it. So do what feels best for your body today, but do get into these muscles. As you're rolling, if you notice a real tight spot, hold it there, and you can circle your foot out to distract yourself from the ankle joint. Eversion, working the foot, keeping the toes pointed. And then find another spot. Inhale to find the spot. Exhale, circle the foot away from the body, eversion, as you are breathing into that self-myofascial release for those hip flexors. Hang in there. Just 20 more seconds on this side. You're doing great work. Hear that breath, ujjayi breath, especially here when you're in a prone position. Belly needs to be in. We don't want to reinforce lordosis. Belly in. Fog a mirror with your exhales. Go ahead and set up on the convex side. We'll only be here for 30 seconds. So get right to it. Get into that fascia. Roll it out. Breathe into it. Footwork if you'd like, pointing the toes, circling the foot away from the body, waking up that ankle joint. Breathing. Our focus is going to be on our glutes and our hamstrings, but we really want to open those quadriceps and hip flexors so that they're not recruiting and firing as they do so frequently. So remember the pelvic flexion rule. If you're feeling those hip flexors, tuck your pelvis under and work in pelvic flexion. If you have chronic back pain, do not work in pelvic flexion. Work in a neutral pelvis. That's somewhere between arching and rounding your back. You've got to find that position to stay safe. Abs are always in. Let's make our way onto our backs, lying on our backs, supine, with our second to heaviest loop band around our outer thighs. So with this loop band around our outer thighs, and this is the purple band with the YouniquelyFit kit, I'd like you, if you have no knee issues, to grab your foam roller and to place your feet on, to place the foam roller under your feet. If you have knee issues, please do this on the floor without the foam roller underneath you. Go ahead and lie down. If you're on the roller, point your toes and wrap them around the roller. Legs are hip distance apart if you have back issues. They can be closer together if you don't. Hands by your side or on your hips. Push down to go up, sending the pelvis up. You can tuck the pelvis at the top. Wrap the toes around the roller. Excellent. And slowly lower yourself down. From here, go ahead and extend your non-dominant leg shin. Extending it out. The legs can be together or hip distance apart, as I said, pointing the toes. Inhale, pelvis reaches forward as you go up on that concave leg, that dominant leg, into your single leg bridge. Using the glute strength, using the hamstring. And exhale, lowering back down slowly. Thighs should be at the same height of your lifted leg. Give me two more on the concave side. Inhale, lift. And exhale, lower. Beautiful. One more. Inhale to lift. And exhale to lower. You know what's next. Let's switch sides. We're going to do some extra reps on that convex side, evening everything out. If you feel knee pain, make sure you're using your feet fully, pointing the feet, or if the foot is solidly on the ground, all edges of the feet are pressing into the floor. And lower yourself down slowly on your exhale. Inhale to lift up. Pelvis is tucked under and reaching for the wall in front of you. Articulate the spine on the way down. Upper back, mid back to tailbone. Lower to the floor. 4 more on this side. 4. And slowly lower. You're doing great. You can always switch to the floor if the roller becomes too much. And 3. Last 2. Pull out on that band, hip distance. If you have back issues, keep the legs together. If you don't, 1 more. You're doing great. Inhale, lift the pelvis up. Belly button pulled in towards the spine and lower down. Wonderful. We're going to make our way up to stand, keeping this second to heaviest loop band around our outer thighs. Go ahead and grab your 3-pound weight. and you're going to go over to the wall. I want your dominant side of your body farthest away from the wall, standing by the wall like you're at a bar. And actually, let's have your non-dominant side farthest away from the wall. And you've got the 3-pound weight in the same hand as your outside leg. Hold onto the wall with your inside arm. We're going to pitch forward, reaching that weight towards our inside leg's foot. The outside leg is going to go behind us in a leg reach, more like Warrior 3. So yes, that's it. Good. So we're moving into a deadlift. Don't go all the way down if you have back issues. You can go to where the body is just parallel to the floor. If you don't have back issues and you can bend that knee and you can tap the weight all the way in front of the toe, you're going to get more of a booty burn, hamstring action. A lot of glute max, glute min. Don't lock the knee at the top. Exhale as you go down. Inhale as you come up. Good. Keep your legs hip distance apart. That's why we've got this band. We also activate the central hamstrings nice and parallel with the legs. Soft bend in the supporting knee. Good. Give me one more. And one. So you should have been standing on your dominant leg for that set. We're going to switch to our non-dominant leg for some extra repetitions, that convex side. Taking it down. So the lifted leg is not really the working leg. It's the standing leg that we're really working. That glute med especially. Glute max as well. Good. Hear your breath. Exhale down. And it really helps to inhale and pull the pelvis down as you come up, getting right under yourself. Exhale down. If you're feeling knee pain, make sure you're using your abs and your lower pelvic floor. That's why I say inner thighs pull back on the way down so that you access the lower pelvic floor and inner thighs to control the knee traction. Good. 5 more. I know you can do it. 5. Make each one count. And 4. Hang in there. We've got a nice stretch coming your way. 3, 2, and last one. 1. Grab your trigger ball. So this can be a lacrosse ball. It can be a tennis ball. Any type of little ball you have. We're going to roll out our posterior tibialis. And I'll show you where that is. Your tibia bone is located here. And you're going to get medially inside below the knee. You can use the foam roller for this if you don't have a trigger ball. Take the band off the thighs, come into a side lying position. You want your top leg to be your dominant leg when you're lying on your side so that you can drop that leg forward and you can place the trigger ball medially close to the knee, slightly below the knee, riding up the tibia, rolling out that posterior tib in this side lying position. So the leg we're rolling is our dominant leg right now. Get into that fascia. Now, if you notice below the knee medially is not tender, go above the knee, right above the knee immediately. There's a fascia line that attaches here and helps to drop the femur bone down. And it can also, if the femur bone's hiked up, it can put pressure on the low back. So that trigger point medially right above the knee is a great place if you're doing cardio pretty frequently or any high intensity work and you feel like you're getting low back pain. It's a great area to release. So get into that spot. Give it a lot of attention. Just 20 more seconds here, finding spots below the knee and above the knee that need your attention. Breathing, trying to not arch your low back too much here. Keep your abs still engaged, pulling in towards your spine. 10 more seconds. Relax your facial muscles. Hear that ujjayi breath. Make your way to the other side. We won't be here for as long, so dig in immediately and try to find the tender spots below the knee first, the posterior tibialis. Often a sign that your knee traction is getting better is when the posterior tibialis is not sore and you're not noticing pain. And sometimes above the knee can be a little more painful because you're starting to recruit hamstrings and glutes and maybe activate the legs even more efficiently. But there can still be some imbalances, which causes you to grab in the hip flexor chain and quadriceps, and that femur bone can hike up. So it just depends on where your flexibility and strength is right now as to where you're going to find that tender area, but I'm pretty sure you can find some area that needs a little attention. One more breath here, and let's make our way up to a comfortable seated position. Great job.